Hi everyone. Welcome to Dr. Ties, your medical expertise whenever you want. Please note that this is strictly for educational purposes and not intended for a formal diagnosis or treatment. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Today's topic is high temperature or fever in babies and children. A high temperature or fever is very common in babies and children. This is usually due to common childhood illnesses such as coughs and colds, throat infection, chickenpox, and vaccinations. High temperature is a natural and healthy response for the body to fight an infection. High temperature can last between 1 to 5 days. If high temperature lasts more than 5 days, this will warrant a medical assessment by a doctor. The normal body temperature can vary slightly from person to person, and it is between 36 to 37 degrees. A high temperature is defined as being 38 degrees or higher. The temperature of a baby or child can be measured with a digital thermometer. If there are no other associated symptoms, a child with high temperature can be managed at home. It is recommended to provide adequate fluids or milk to prevent dehydration. Paracetamol can be given if babies and children show signs of discomfort or distress due to high temperature. It is best to keep them at home and monitor them regularly, including during the night. It is not advisable to undress or sponge babies and children to try to reduce the temperature. These are outdated practices and do not usually work. Babies and children should not be covered up in too many clothes or bedclothes, even if they give the impression that they are cold. Aspirin is not recommended for children under 16 years of age, and it is best not to alternate between paracetamol and ibuprofen unless necessary or advised by a doctor. Paracetamol is not suitable for children under 2 months. Ibuprofen is not suitable for those under 3 months and if there is history of asthma or chickenpox infection. It should be noted that urgent medical assessment is advised if a child under 3 months has a temperature of 38 degrees or higher, and a child 3 to 6 months old with a temperature of 39 degrees or higher. If there are other symptoms such as a rash, vomiting, breathing difficulties, drowsiness, or dehydration, this will also require urgent assessment. Temperature alone may not be a reliable way of knowing how unwell a child is. If a child or baby has a mild fever and looks unwell, they must be assessed by a doctor as soon as possible.